So how do we treat post-COVID dizziness? I've been talking about post-COVID dizziness all week, and now we're going to get to the thing that I always say is the most important: treatment. If we haven't met already, my name's Amy. I'm a vestibular physical therapist, which means I treat dizziness and balance problems for a living, and I do treat post-COVID dizziness a lot. Those of you who've followed me for a long time already know what I'm going to say, and that is, it depends. When it comes to viral infections, including COVID-19, it really depends on what the virus has caused to break down in your system. Just simply knowing that you got dizzy, when you got dizzy, and how long that dizziness lasted and what it feels like is not enough information to know exactly how you're going to have to treat it. There are many kinds of scans, assessments, and tests that need to be done in order to figure out what parts of your anatomy are working well, what parts aren't, and what medications and treatments you might need to treat your dizziness. Professionals you might need to see who might need to run batteries of tests, each their own, include cardiologists, neurologists, ENTs, audiologists, and vestibular physical therapists. Each person in their respective field will determine what is working well and what is not working well about your neurological, vestibular, hearing, and balance systems. While some people might respond better to, say, a migraine or an SSRI medication, other people might respond better to vestibular rehabilitation. What gets ordered as treatment for you will depend on your testing and sometimes even include some trial and error. Here are some general tips and things that we know if you do them, it will help with your dizziness. Number 1, get up. Any kind of vestibular or cardiovascular suppression will only be made worse by staying in bed. Getting up, moving around, and exposing yourself to a different level of endurance each day will help you to build that endurance, whether it be cardiovascular or vestibular in nature. Number 2, structured energy conservation techniques. This sort of goes along with the first one, which was get up and move, because you need to get up and move at appropriate times and structure it so that you're moving a little more each day, but not overworking your body to the point that you go into a vertigo spell. Number 3, manage your anxiety. Although admittedly dizziness can be very unpleasant to feel, and the pathways that dizziness travels down can also be the same pathways that are used for your body's fight or flight anxiety system, you need to rewire your brain to believe that a little bit of dizziness is a good thing. Pushing yourself to be a little bit dizzy a few times a day can go a long way in your recovery. And tip number 4, pay attention to your diet and hydration levels. Reduce or eliminate things in your diet which can induce dizziness, such as high sodium foods, high caffeine, alcohol, or even smoking. Stay hydrated, drinking at least 4 tall glasses of water a day. And try to avoid spikes and dips in your blood sugar by eating small meals throughout the day as opposed to fasting and then eating one big meal. Remember that recovery from a long-term disorder is a marathon, not a sprint. Put your blinders on, follow your clinician's recommendations, and keep going.